What's up? What's up? I'm Dr. Omatma, host of Egg Meet Sperm, where we're busting fertility myths, sharing tangible tips for your fertility journey, and bringing you the most knowledgeable guests to support your journey to parenthood. This podcast is for both women and men because getting fertile as fuck is for both partners, don't you think? Remember, just listening to this podcast won't get you pregnant, but following the tips we share just may. Let's get you fertile AF so that you can co-create the family you dream of. And if your partner's not listening to this, make sure to share this episode with your partner. Hello and welcome to Egg Meet Sperm. My guest today is Dr. Leah Gordon, who is a hormone and fertility consultant with her training in naturopathic and functional medicine. She specializes in natural fertility, natural IVF support, root cause hormone balancing, and integrative women's reproductive health. She is the founder of Womanhood Wellness, a natural wellness education platform where women can get honest and easy to understand education, functional medicine recommendations, and the empowerment she is not getting at her regular doctor's visits. Her passion behind womanhood wellness and consulting work she does was sparked out of her own personal story struggling with birth control issues, low libido, painful periods, male factor infertility, and navigating IVF as a naturally minded doctor. Hello, Dr. Leah. Welcome.
Hi. Thanks for my bio. I know that's a mouthful. Thank you so much for having me. I can't wait to be here with you.
Absolutely. I'm so excited to talk to you. And I know that part of your journey has been with IVF and with navigating this whole world that I feel like, especially as a naturopathic doctor, is kind of like outside of our realm, but we're also like in it a little bit. So how was it for you? What has that journey been like?
Yeah, it was a really interesting journey because being a naturopathic doctor, I have such a strong belief in the healing ability of the body and in natural conception and doing so many things naturally. As many of us naturopathic doctors do, we try really hard to help our patients balance and get to a place where maybe they can wean off medications and not have to take hormones or do other things, especially in the getting pregnant process. And there's many patients I see in practice who I think are shuttled into the IVF route when maybe they could have been helped in other avenues. You know, maybe IVF wasn't necessary for them if they had a thyroid issue or PCOS or something like that. And so when we found out that my husband had no sperm, I was determined to find the root cause and to solve it holistically. And we found out about his sperm when I was still in naturopathic medical school. So this was a while ago, and I didn't have the ability to do much for him. And we went to so many different doctors trying to figure it out. And we really got to the point after almost 6 years of trying that we discovered, based on all of his issues, that there really wasn't any other option for us other than IVF with testicular retrieval, because his sperm situation was such that they had to go in and actually retrieve through surgery to get sperm, which is not how IVF is typically done. And so going through that process was interesting because I was not only a patient, but I was also a doctor being a patient and seeing that conventional fertility model, knowing the holistic fertility model. And so there was a lot of conflicts of philosophies, and there was a lot of eye-opening experiences that I had that I realized how much support this path really needs and how much we as naturopathic doctors can help in so many ways. And just there's so much more optimization that can be happening along that path that I wouldn't have known if I wasn't on the inside going through it myself. It was an amazing experience, eye-opening. I'm ultimately so grateful for IVF because we literally wouldn't have our daughter without it. And I know a lot of the steps that we took were big reasons as to why ours was so successful. And why I did things so differently was because of my background in naturopathic medicine. So I'm excited to share that with people.
Yeah. So tell me, let's get into it. What did you do different?
Yeah, that's such a great question. Okay. So my situation was male factor IVF. And so one thing that people need to remember is IVF is a tool. It's not appropriate for every fertility issue. And for certain fertility issues, it's a wonderful tool. For male factor, when there is no sperm or very, very little sperm, it's a wonderful tool because the whole point is that in my case, the sperm couldn't get out of my husband's body in his ejaculate. So we could have had sex for the rest of our lives and probably have never gotten pregnant. And so through IVF, it allowed us to get the sperm in a different way. I had to do my egg retrieval, created the embryo and implanted. And so we got over our issue. Other places where IVF can be really helpful is like a blocked fallopian tube, or for some women, if they have very low egg counts and reserves. But the important thing to remember is that every fertility situation is so unique and different. And a lot of people who traditionally used to do IVF were maybe women who had PCOS or who were older, or all of these different factors. And when you work with your IVF doctor, your reproductive endocrinologist, what I did differently, one, I interviewed 4 different doctors before I chose. So I think a lot of people just kind of walk into the first clinic that they see and they're like, this is the path and this is the route. And honestly, they were all so different. And I felt very different at each clinic. And I am a younger person in the IVF world, even though I'm in my 30s. I am technically considered younger. And I had what's called polycystic ovaries. So I wouldn't technically be diagnosed with PCOS because I do not have high androgens, which is like testosterone. I don't have acne or hair growth. And I have regular cycles for the most part. So I don't meet the diagnostic criteria for PCOS, but I do have polycystic ovaries. And so my AMH was 8, which is really high. Just to give everyone a reference, women who have lower egg counts, we want that above 1. And a lot of people going through IVF, it's less than 1. A typical person my age without PCOS would maybe have between like 1 and 4. So mine was 8, meaning I had a lot of little follicles. And the thing about IVF is that when they give you the medications to push you to make more follicles and eggs, that's how it works, is they give you hormones to make more eggs out of the follicles you would naturally ovulate that cycle. You can hyperstimulate and basically push your body too hard. And so what I did was something called mini IVF. And mini IVF is a lower dosage protocol so that I didn't push my body so hard to make a lot of eggs. And this is, I think, a missing piece that a lot of women don't realize. And it's a bigger deal for women who do have PCOS or for women who are younger, who aren't in their late 30s or early 40s going through IVF. So not all doctors do this. I work with a lot of IVF patients around the country, and some just don't have that option. But if you have the option, if you're going through this route, to look for a doctor who's trained in mini IVF or lower dosage protocols, that was the first thing I did. The second thing I did was obviously optimizing my husband and myself before IVF. We had a long time, obviously, because we were trying for a long time. But the biggest thing was detoxing and working on our microbiome, which I do not see happening in the IVF world at all. Most people try for a year, can't get pregnant, and so they're automatically just put into IVF or IUI. There's really no emphasis put on optimizing the quality. So the quality of the woman's eggs or the quality of the man's sperm. In the IVF world, they don't care because they say, oh, we don't need your husband to have good sperm because we're just going to use ICSI. ICSI is when they just, it's not like this, but it's like taking tweezers, getting a little sperm and sticking it in the egg. So the sperm doesn't need to be swimming. It doesn't have to be good quality. None of that is essential to impregnate and create an embryo.
And I say this to people all the time. It's like the number of times that men come in and like say, oh, the IVF doctor already tested my sperm and they were amazing. And I look at their papers and I'm like, this is not amazing.
Yeah, it's not amazing. It's maybe amazing in their mind because they're like, well, we only need like 6 sperm. And
exactly. And they don't need a lot of sperm. They don't need them to be amazing morphology. They don't need them to be great motility because IVF kind of bypasses a lot of those needs.
Yes, it does. And it bypasses the need for conception. However, my opinion, and we know this as naturopathic doctors because we do so much with environmental medicine and quality medicine and functional medicine, and we understand how important that is. But I personally feel if more emphasis was put on quality of both the man's sperm and the woman's health and eggs, I think we'd have less lower quality embryos and less transfer failures.
Absolutely.
Because this is just not
How
a
do
part
we
of...
change this?
Oh my God, I know.
Like, I think it's just so amazing that we don't have that focus. And it's like the IVF game is very much a numbers game, right? The more numbers we have, the better your chances.
Yes.
But if it was the more numbers we have of great, amazing embryos, the better your chances.
Yes.
Things might be very different.
Absolutely. And so I'm so much bigger on quality. And the doctor I ended up choosing, his name is Dr. Chang at Hanabusa IVF in San Diego. I really resonated with him and I chose to go with him because his philosophy was similar. And the reason why he does mini IVF for people like me is he says, I'd rather you have a smaller amount of eggs retrieved, but that are higher quality versus many IVF clinics are like, we're going to like pump you to get as many eggs as possible because it's a numbers game. And if you lose 50% of your eggs and 50% of your embryos, it's like, but if you had better quality from the beginning, you might not lose as many and you'd have a better chance. And so I have friends and patients who have retrieved 40 eggs, literally, because they're young, male factor, retrieved 40 eggs and have lost or miscarried every single embryo that they've implanted. And it's like, that is not okay. Whereas I retrieved 12 eggs, even though I had polycystic ovaries, and I have 4 good quality embryos. And the statistics of that, we had 5 that fertilized because my husband hardly had any sperm. So of the 5, 4 were high quality, which I think statistically is much better than the average for IVF,
Absolutely.
even though I know I'm young in that regard. But anyways, the important thing is to focus on quality. So I'm a big believer in optimizing both the man and the woman before IVF, both looking at your toxicity exposure, reducing your exposures to any things, eating organic, making sure that you're eating really good quality foods, and working on your microbiome. There's actually a lot of studies showing that the bugs in our gut and our vagina actually really impact outcomes as well in IVF. And so the thing about IVF is, unless you've been through it, you might not realize, but you go into the clinic so many times. They do so many ultrasounds. They're always using the gel that they use for the ultrasound, for the transvaginal ultrasound. And most of the procedures involve antibiotics. And so the process alone of just doing IVF is really hard on your microbiome. And we know that the outcomes are worse in patients that have poor microbiome. And so it's like the process is worsening the outcomes in and of itself. So the other thing I recommend for people going through IVF is to make sure they're on a really good probiotic, maybe doing even vaginal probiotics to counteract the negative effects from the ultrasound gel and all of the antibiotics. And other things like Saccharomyces boulardii is a great strain to take anytime someone's been on an antibiotic. And so those are kind of the things I recommend my IVF patients do and that I did myself as well for just that process. And then the other key thing that I do that a lot of people don't do is I'm not a fan of fresh transfers. I think frozen transfers are optimal, and especially if you can take 3 months off between egg retrieval and transfer. And I know this is an unpopular opinion in the IVF world because it's like, I can't wait 3 months. Like, what do you mean? Like, that's a long time. And I know in the process of getting pregnant, it does feel like a long time, but because of what we know in naturopathic medicine and understanding the hormone physiology, we know that it takes about 3 months for the body to kind of recycle and resync its hormones. When I'm making herbal recommendations to try to help a woman cycle, I usually don't even retest or look at any change until 3 months have gone by because it can take that long. And so when we're taking a bunch of medications through for an egg retrieval to make something happen, I've been there and I was doing a mini protocol. I can't even imagine what it would be like to be doing a full protocol and then the next week implanting an embryo. To me, it's no question why the studies are showing that frozen transfer is better. The body just went through a really intense, stressful situation. I was awake during my egg retrieval. I opted to not do anesthesia. And so I know what the body goes through during that egg retrieval. And let me tell you, it is stressful. They stick a needle through the uterus into the fallopian tube, into the ovary to pull out the eggs. And I was awake for it. And I was like, this is insane. There's no way that my body would have like accepted a pregnancy a week after this. There's no way. And so I'm a big fan of taking a break. And in that time, the 3 months, taking a lot of glutathione and DIM and all of these other things that we know that can help detox the liver and support your body because you just took a bunch of synthetic hormones and pushed your body. For some people, they're taking synthetic hormones. Some people are taking trigger shots and other things. Every protocol is different. But to just give your body a chance to chill and relax and like reset and focus on stress reduction and just getting back into your like fertile zone before you go and do the embryo transfer. So that's the other thing that I learned through my process and that I always recommend for my patients and clients.
That sounds incredible.
Yeah.
Like literally everything you said just gives me chills because it's so on point, right? Like making sure that we're accounting for both partners, optimizing the quality of egg and sperm, really like understanding the physiology and putting the pieces together in a way that will support optimal fertilization and conception. is, yeah, it just like, oh, yes,
I
yes,
know.
this is totally what we need.
I know. And it's such a passion of mine because we were so blessed. I know we were blessed. And I think luck is partly what happens to you and partly what you create in your life. And so, yes, I feel lucky that I have an amazing daughter and I feel so blessed for that. And I know we took so many steps to make that more of a reality. And she's so wonderful that it makes me want to help people even more have a baby. Because I feel like if I had a really hard child or a really hard postpartum time, I would maybe be like, oh, I don't know. Do you really want to do this like motherhood thing? But that has not been my story. And so I really feel everything that has happened to me was really divinely orchestrated so that I could help other people in every way, the positive and the negative. That's really how I see life in the world. And so I'm excited to share this with people.
Absolutely. And I just got the chills when you said that because I had the same experience. I was like, oh, I'm super passionate about people having babies and fertility and all of the things. And then I had a child. And then it was like, oh my God, like people need to have this experience because of the experience that I now have, right? Like motherhood is just so incredible and parenthood in general. But I feel like as mothers and as people that have been on this path and on this journey, it just feels so incredible to get to that other side and actually manifest our love into a little being. It's such a beautiful thing.
It is so beautiful.
Yeah. I feel like I got more passionate about fertility after having a child.
Totally. I feel that way very much so.
Yeah. Yeah. It's awesome. So you mentioned a few times about detox and detox goes in a lot of different ways. And there's like such a can of worms sometimes. So let's talk a little bit more about detox and what that means in the context of fertility.
Yeah, it is a can of worms. And I made a post on this a few weeks ago on my Instagram about how I feel like the rise in infertility is so high in humans and in other animal species. And I mentioned how Mother Earth is maybe bringing this to our attention and our awareness because anytime in biology, if we look at a species and their reproductive rates are going down or there's something happening, as a biologist, you automatically think what's going on in the environment. That's totally not a weird thought at all. And for humans, I don't know why we have that disconnect. So many people just don't really make the two connections, or maybe people just aren't aware of the high rates, or maybe they don't understand the effects of low levels of toxins on fertility like someone like a naturopathic doctor like us do.
And to a certain extent, sorry to cut you off, but to a certain extent, we've kind of like disconnected ourselves from nature so much that we live in these little bubbles called houses with our four walls, and we forget that we're still a part of nature.
Yes.
Like nature is still interacting with us, even if we're not living in the jungle.
Exactly. And we're impacted, we're mammals, we are impacted by all of the same things that all the other animals and creatures are impacted by. And unfortunately, our choices and behaviors really negatively impact all of them, not only us. And so it's like a whole planetary thing that we have to talk about. But when we talk about detox, what I mean is mostly it's a lot of the chemicals that we are exposed to on a daily basis and learning how to limit the exposure. I bring it one step further in supporting companies that aren't bringing toxic products into the world because it really starts at the industry level. And then doing things to help your body eliminate what you are exposed to. So the traditional term of detox, can be applied to so many different things. The proper term of getting things out of the body is biotransformation, but a lot of people don't really connect with that term. And so when I say detox, I mean stopping exposure as well as getting help in eliminating toxins from your body. And so that can be as simple as pooping every day, drinking lots of clean water, maybe taking really simple supplement supports like chlorella or chlorophyll or things like that, all the way to the extreme, which is what my husband had to do before our fertility because he had really high heavy metals and plastics and pesticides and herbicides and all of these not like very sperm toxic chemicals. He went all the way to the extreme of doing like IV chelation therapy to bring down his mercury levels and things like that. So not everybody needs that. And I don't recommend that for everybody. Actually, very few people would I recommend that for, depending on their vitality and their health. But the simplest first step is to just stop or limit exposure. Things like phthalates are very much indicated in poor sperm quality and in female issues. And phthalates are found in products that have fragrance. So if you actually look at the bottle of soap or shampoo or deodorant or whatever, and it actually says the word fragrance, the industry hides phthalates in that label. So they don't have to say any of the chemical names of the phthalates. And phthalates themselves help fragrance stick around. So if you wash your clothes and they have a scent or a smell, that's most likely phthalates. If you smell perfume on somebody, if you have an air freshener or anything that has a scent, most likely is because of phthalates. And these are what are really, really impacting fertility, especially males. So much so. Oh, go ahead.
Candles too, right?
Yes, candles, anything that has a scent, unless you made it or you highly trust the company and it is only made with essential oils, it most likely has phthalates in it. Phthalates are also found in soft plastics. So any plastic item that is like malleable is where phthalates are found. So like the vinyl shower curtains that you have in your shower, or baggies, wrappers, anything that is soft plastic will have phthalates. So becoming aware of what they are, where they come from, and how to limit and stop exposure, changing your personal care products, getting plastic out of your life. Phthalates are water soluble, so they are excreted much easier and quicker than some of these other persistent chemicals that once you're exposed, they kind of stick with you for a while. Those are a little bit harder to just get out of the body by stopping exposure. Things like DDT, which was a pesticide that we used to use and is still used in many parts of the world. Those kind of things are a little harder to quote unquote biotransform out or get out of the body. But other things like BPA is found in hard plastics. So phthalates make plastic soft, BPA makes plastic hard. And these have been shown to be very detrimental to sperm. They've been shown to contribute to PCOS in women. They're a estrogen-like chemical. So obviously they've been shown to cause breast cancer and things like that. But from a fertility perspective, the biggest and easiest way is to just not buy products with fragrance and don't use plastic. I mean, that really cuts out a huge majority of all of these exposures. And just becoming aware, the furniture you buy, the carpet you're using, it can be a little overwhelming. I get that. But just once you're aware and you start choosing better options and products, that's one of the best things that you can do.
Yeah, absolutely. And then in terms of things that support the liver that will help, quote unquote, detox.
Yeah. So once you have stopped exposure, the next step is to kind of get things out of your body. So the first thing is you always want to make sure that your routes of elimination are open first before you do anything else. And what I mean by routes of elimination, that's like your bowel movements, making sure that you're pooping every day. I have a lot of patients who are like, I have normal bowel movements. I poop like once a week. It's like, that's actually not normal. You want to poop at least once a day. And if you're not, potentially looking at your gut health, your microbiome, your dietary fiber intake, your water intake, or supporting yourself with something like magnesium citrate, like Calm is a brand I really like, but really getting to the root cause instead of just using that as a Band-Aid. So making sure you're pooping daily, that you're peeing often, drinking lots of clean water, making sure that your water itself is coming from a clean place, maybe getting a better filter. I have all the resources for all my favorite products at my website, womanhoodwellness.com/products, if you're interested in any of that. But pooping, peeing, sweating. So if you have access to a sauna or an ability to sweat, if you're a really good sweater when you exercise, that's great. But if you're not, maybe doing things to help your body eliminate that way. The key thing to know is if you're a man and you're in the sauna, it will affect your sperm. So you have to detox, then take a 2 to 3 month break before you start trying, or the heat from the sauna will affect your sperm. It's like, this is why male factor infertility can take so long, and why I always recommend checking sperm right away for any couple. The other thing is breath. So doing really good breathing practices. A lot of patients are anxious and they just don't breathe deeply. They breathe very shallowly, and making sure your breath you do breathing practices and the air that you're breathing is clean, considering a HEPA filter or something like that. And then as far as your liver is what actually processes packages and helps your body get rid of these things. So the biggest thing is to support your biotransformation. I really love in the food place, eating lots of brassica foods. So this is your broccoli, your cauliflower, your kale, chard, anything in the brassica family, anything that has that sulfury smell, eggs. When you leave broccoli in the fridge and it kind of smells like rotten eggs, like that sulfur smell is actually what helps your liver. making sure you have enough protein. A lot of people don't get enough protein and you need the acids to help with liver detox. Making sure you have enough B vitamins. So I'm a big fan of women being on a prenatal, even when they're not technically pregnant, because you're preparing your body with all those optimal nutrients. I actually helped design a prenatal that I think is a really great option, but there's some good brands out there. Just make sure you're on one that is optimal. And then other specific things like glutathione is a great nutrient that helps with your liver. If you know more of your specific hormonal imbalance and you're doing preconception, things like DIM will help to move estrogen into a better place. Milk thistle is an herb, burdock, dandelion. These are all herbs that are really good for the liver. Not safe while pregnant, but good for preconception. And so I'm a big fan of taking a break, doing a detox and taking a break from trying during that time. And then once you feel like you're in a good place, maybe you're giving yourself like 3 months to detox, then you can start trying again. Because a lot of the things that we do to help get chemicals out of our body, we don't want to be doing that while we're pregnant.
Right. Absolutely. But again, please do not detox if you're trying to conceive right now.
Yes, exactly. If you are like in the middle of like, we're having sex every month, don't be doing this stuff. And definitely don't be sauning if you're a man, because your sperm is not going to do good.
Yeah. Yeah.
Yeah. And this is the hard part too, why I think it's not talked about in our culture, because it takes time. And a lot of times when people have started to try and then they're put down the IVF route, they don't want to take 6 months off and do this stuff. Or maybe they don't even know it's an option and they would if they could, but it does take time. And that is why I'm such a big fan of people getting their fertility checked before they start trying.
Absolutely. I think it's like scary to take months off, right? It's like so many couples have been put in this mode of like, if you don't get pregnant right now, it will never happen. But that right now could be now, but they'll say the same thing a year from now. So it's really important to remember that the context of right now is actually different for different couples. And obviously, like, talk to someone before just saying, oh, I'm taking a break. But talk to someone who can actually support you in doing something actively, even while taking a break. And I think that that's like the navigating the hard part of this is, I feel like this is the hardest conversation I have with people is like, we're going to pause for a few months, and they're freaking out.
Yeah, I know. That's why I'm so
do IVF.
I know. And that's why I'm so passionate about Womanhood Wellness business that I built. It's all around the idea of helping women who want to be moms, but I really want to like get to women before they're like actively like, I am infertile right now, because I love supporting those people too. However, our hands are a little bit more tied. And so if we can empower women to just think about their fertility before they're trying, and really optimize both the man and the woman. As soon as you get married, my dream would be everyone's wedding gift would be like a sperm test and a hormone imbalance test, just to make sure you're good for whatever it is that you want to try. That could be 10 years from now, but like, make the changes now.
Yeah, absolutely. It's never too early to know what your hormones look like or what your sperm health looks like. I know that you've done so much work in the male factor fertility space. So are there any other tests that you think are really important besides the semen analysis?
So I do think a DNA fragmentation test for men can be really helpful. Certain studies have shown that even with a quote unquote like normal semen test, so let's say a man comes back and it's like, it looks okay. It's not great, but it's okay. A lot of times the DNA fragmentation tests will show more telling evidence of what's going on. And what that means is how much of the sperm is broken down, their DNA is broken down, because someone could have like a normalish count, an okay morphology and motility, but let's say they do IVF or they're trying naturally and they have a bunch of miscarriages. The thing that people need to remember is miscarriages, 40% of the time is male factor. And people don't think that. And we don't remember it because it's happening in the woman's body. Often the woman blames herself or whatever. But if it's a chromosomal abnormality or an issue and it's not clearly a low progesterone or some other fibroid or issue like that, you need to look at the man and his sperm, because very often the quality issue is actually coming from the man and not only the woman. And so the DNA fragmentation test can give you more of a sense of how much do you need to actually support this man? Because a lot of times, like you said, in IVF, they'll do the test and they're like, yeah, you're good enough. you are good enough. But if you do the DNA fragmentation test, you might see that, like, you know what, I personally don't think you're good enough yet for even IVF. I think you should optimize, get the toxins out, improve your nutritional status, all the different herbs and nutrients that we know, the dietary changes, the environmental changes that you can do. And again, I have a course on this. I have a whole course on male factor and fertility and how to optimize sperm. But if you can do that and improve your DNA fragmentation, then you have much better chance, whether naturally or through IVF, to have a healthy pregnancy that goes to term. And then obviously running like a man's hormones, big key ones obviously are testosterone, FSH, and LH to see what's going on with your hormones. But I also like to run homocysteine. Homocysteine is traditionally a marker that cardiologists run, but what it tells me if it's high is that you either have a really high toxic load or you don't have enough B vitamins. And the homocysteine is a part of the thionine pathway, which it's okay if you don't know what that means. Basically, it has a lot to do with methylation and how you make DNA. And so if you can't make DNA, you can't make healthy sperm, and you can't support a healthy little blob of DNA, which is what a sperm is. And so that will be a clue to me oftentimes that someone either needs way more B vitamin support or we need to look at their toxins. And then I also like to run HSCRP, which is an inflammatory marker. If a man has a really high inflammation, then I want to go try to find where that's coming from. Is it a gut problem? Do you have an infection? Do they have a mouth infection? You know, a lot of men have, you know, root canals and other things, and they can have a festering infection that's actually impacting their fertility. So there's so many things to look at, but those are some key markers that aren't the traditional ones, I would say.
Yeah. Yeah. And I totally agree with you with the homocysteine. There's actually studies that have connected hyperhomocystinemia or high homocysteine levels to recurrent pregnancy loss in the partner. So like, this is not stuff for those of you that are listening in. We're not making this stuff up.
No, definitely not.
Like, backed by science. People always ask me, like, if you know this, why doesn't my IVF doctor know this? Like, I don't know. Maybe you should listen to my podcast. I have no idea.
I know. It blows my mind, honestly. Like the questions I would ask some of our male endocrinologists, and I know, and the urologists, many of them are wonderful. They're all great. But I feel like there is a huge lack in their knowledge and education of understanding what's really going on the other side. And they could really be supporting patients. So I really encourage them to keep up with the research and look at things outside of just the medication protocols, you know, that they use. The homocysteine being elevated was actually what I discovered that took me down the path of toxicity for my husband. Once I became a doctor was when I was taking his health into my own hands. And that's when I discovered what was going on in that regard. And just to give people a reference, we like a homocysteine around 6, maybe 7 max. And his was 23, which to any like naturopathic or functional medicine doctors listening, you're probably like, oh my God, that's really high. I mean, I'm concerned when a person's creeping up into like 12, 13. Yeah. And so I'd never seen any homocysteine as high as my husband's.
No, I think the highest I've seen is 18. And that was very recently. Yeah. And I was like, oh gosh, we're doing all kinds of things.
No. And I saw that on my husband. I was like, oh my gosh. And he took a multivitamin every day. So that's how I knew it was toxicity.
So I'm just curious, like, what was his exposure from?
Well, my husband has so many different factors. So he is very multifactorial. He had bilateral varicoceles. We fixed both of them surgically. Didn't help, actually made it worse. He had, from a toxicity perspective, he had really high mercury. He had mercury fillings, dental fillings, when he was a teenager, and we eventually got them out. But he had that. He ate a lot of fish growing up. His mom ate a lot of fish when she was pregnant. She didn't know at the time. She ate tuna almost every day when she was pregnant with him. He was in utero when they were doing construction on the home. So he was exposed to a lot of phthalates in the 80s, new materials, new building materials, which is where a lot of phthalates are. And we know that women's exposure, when she's carrying a baby boy in utero, when she's exposed to phthalates, that it can affect the reproductive development of their male boys. There's no way to know for sure if that's a factor. He also has some genetic mutations that have affected a little bit of the vas deferens. It's like he has a soup of infertility. It's like all of these like subtle things. But from detoxing, he used to spray herbicides and pesticides as his summer job when he was a teenager, without a mask, without anything, you know, just spraying thistle, like pounds of pesticides and herbicides. He's an engineer. And so he worked Well, he was a nuclear engineer, but they monitor the nuclear radiation pretty well. Who knows though? But he does a lot of plastic manufacturing, and so no mask, breathing all the plastic. It's just like all the things. I'm like, this is crazy. So from a toxicity perspective, it was pretty bad.
It's a big soup.
Yeah, big soup. Anatomical issues, exposure issues, potentially in utero issues, potentially genetic factors. So that's why, even though we did all the detox and everything, we still had to do IVF. But I do feel that the sperm that he was making, because we did all of the detoxing, really impacted the quality. I feel like if we had gone through IVF without that, we might not have had any healthy embryos.
Mm-hmm. Thank you for sharing that, because I feel like it helps people think about oh yeah, my husband does that too. Or, oh, he's probably had that exposure too. So just kind of obviously your partner seems like the extreme scenario, but
yeah.
we I'm sure there are so many guys that have these small levels of exposure that aren't necessarily thinking about it. And if we haven't stressed this enough in this episode, it's really super important to consider not only the numbers, but what's the quality of numbers of embryos that are going to be produced.
Yeah, I just want to throw this out really quick because, I come from an ag background. Clearly, it's obvious if someone grows up on a farm or they do a lot of yard work, spraying herbicides, pesticides. But one of the biggest sources of herbicides and pesticides are golf courses.
Yeah.
So if your partner is an avid golfer or live near a golf course, you probably have more exposure than a farm because they literally just douse the golf courses with them. So just other things you can test to see if you have high levels of these exposures. And so there's options to do that. So there's things you can do, but just being aware is the first step.
Mm-hmm. And the other one is wine country. So I spent a lot of time in the Bay Area where there was a lot of exposure.
Yes.
Just from not only drinking wine, but living near the wineries. It's a lot of exposure to herbicides and pesticides. And then I always give a plug for this because I just feel like it's amazing that women don't know. But the biggest plant that is sprayed with Roundup is cotton. And we're making pads and tampons out of that cotton that we're then putting into our reproductive system. So I just insert this everywhere because I want people to stop using pads and tampons. Yes. That is my secret mission. It's let us stop. First of all, that's polluting the environment, which is not great. But the other thing is the impact on our hormones, our health, and 70% reduction in pain with cycles just from switching out these toxic products.
Amazing. I know. I'm really passionate about better periods as well. Because it's there's just so much there and our vagina is so absorbent.
Yeah. And it's one of the easiest switches you can make. It's going to cost you less money. It's better for the environment. It's better for your body. It's better for your fertility. Just all around, there's no reason not to switch it out, except the fear that you're going to leak.
Yeah.
So you'll get over it.
There's things to help with that too. Absolutely.
Yeah. Awesome. Well, this was so fun. I'm so glad that you were able to join us today. Is there anything you want to share with our listeners before we close for today?
Oh gosh, there's so much I want to say. I would say if you're on the fertility journey, just make sure that you get lots of different options and opinions. Don't go with the first person or the first doctor that says this or not that. I would definitely look from more of a holistic perspective. And if you want any resources, womanhoodwellness.com, like I said, is my company. I have courses. You can test your own labs there. You can do that toxicity test I'm talking about. I have supplement recommendations. I hold workshops. So head over there, lots of resources, and follow me on Instagram at Dr. Leah Gordon and continue the conversation, or TikTok if you're a TikToker. I'm on there now too.
Awesome. Well, thank you for joining us. We'll share your links in our show notes. I know you have an amazing gift for our listeners, so we'll share that there as well. And for all of you listening in, make sure to tune in with amazing tips with Dr. Leah Gordon for the rest of the week.
Awesome. Thank you.
Was that an amazing episode or what? Make sure to check our show notes so that you can link up with our guests. And if you're not a part of our secret Fertile AF community, you can join for free via the link in our show notes. Last but not least, Have you showed us some love lately? It would mean the world to us if you could share and review our podcast. Thank you so much. We'll see you next time on Egg Meets Sperm. Peace.